All right, so now we're going to move on to follow-ups from our last meeting. So we last met on September 19th when we reviewed the State Department of Education's EdSite data portal and the use of American Rescue Plan funds by OPM. The minutes from our September 19th meeting were circulated to the council in draft for your review. We did not receive any edits to the minutes, so I will ask right now if anyone has any corrections or edits to suggest to the minutes at this time.
Lieutenant Governor, I'm sorry, I did receive two small edits to the minutes. One was a title change in title for one person, and the other, and that was it. I'm sorry, that's the only change to the minutes.
Great. Okay. And I'm not seeing any other changes. So are there any objections to accepting the minutes as final? All right, seeing no objections, the September 19th minutes are hereby accepted as final. Any other questions or updates from our September meeting? Seeing none, we're now going to turn to review of our draft annual report to the legislature. Our last report was delivered on September 23rd, 2022. Since then, we've had 5 meetings, including this one, December 13th, 2022, March 7th, July 18th, September 19th, and today, December 12th, 2023. The report summarizes the discussion topics that we've had for each of our meetings and notes which the council member-led discussion was for each of these subject matters. We included links to the meeting minutes for each of the meetings prior to today, and not that the ones for today's meeting will be made available online. And so I'm wondering if anyone has any questions or comments about our annual report to the legislature. All right, so seeing none, we already have circulated the report in draft prior to this meeting, and it's our intent to deliver the report to the legislature next week, Wednesday on December 20th. So if you should have any further edits or any questions, please get them to Kari Sullivan and Christine Jean-Louis by 4 p.m. Monday, December 18th. So I'll ask one more time if we have any other updates before we turn to our presentations. All right, so we're going to go right to starting with the Office of Early Childhood on the continuity of learning. And I want to thank OEC for doing this presentation, and we'll let them take it away.
Wonderful. Thank you so much, Lieutenant Governor. It is such a pleasure to be here to present today on the continuity of learning. And as we thought about this presentation, we wanted to narrow it down a little bit. And so we are going to focus today on the importance of transitions. There are many points in time during a child's early years in life and their learning and development when they are coming into important intersections where they need to change programs or transition through different systems. And those are critical moments where the continuity of learning can be impacted. And when we think about transitions, we are thinking both about the relational aspect of a child's and a family's experience, but also the material, the educational content between the systems in which the child and family is interacting. And talking about partnerships, when we talk about transitions, we can't do that without acknowledging the important work and the strong partnerships with the Connecticut State Department of Education, because many of the points in which a young child goes through, many of the transitions happen to the educational system from the early childhood system. And so we are pleased to have Renee Kleinman, education consultant for early childhood, Part B, 619 from SDE here along with us today, and members of the Office of Early Childhood, including Nicole Cassette, Part C Coordinator, and Kim Pileska, the Early Care and Education Division Director. A focus on the transition experience can also help ensure that children receive the necessary services and supports in early intervention in language and wraparound supports and resources. I'm now going to hand it over to Nicole and Renee to talk about the continuity of learning when it comes to early intervention. Next slide.
Thank you, Deputy Commissioner Trueworthy. So I'm going to give a high-level overview of early intervention, which is otherwise known as birth to 3 in Connecticut. And early intervention is provided, it's under Part C of the Individuals with Disabilities Education Act, IDEA, and is available in each state. But in Connecticut, we do call the program Birth to 3. So it's a system that works with families who have children with developmental delay or disabilities from ages 0 to 3. And in Connecticut, our scope is supporting families with children who have a significant developmental delay based on standardized testing or a medical condition that is diagnosed by a doctor, which could result in a high likelihood of developmental delay. In Connecticut, we do have a narrow eligibility, and other states like Massachusetts have different eligibility criteria, such as at risk, which is Massachusetts. Birth to 3 does provide supports in the home and in other natural learning environments. So what that looks like is going into grocery stores, or it could look like the photo here. You'll see a child care center or an early childhood classroom that child might be spending their day-to-day. So wherever that child is going to spend their day-to-day, Birth to 3 will be going in and supporting. So that looks like supporting caregivers, but also teachers or child care center staff, whomever is interacting with that child. Research is really based and grounded in the relational approaches and to optimize childhood outcomes of children in the Birth to 3 system. We recognize the importance of relationships and understanding that children learn best with those whom they trust. So that is really the groundwork for the pedagogy of Birth to 3. Next slide, please. With that, Connecticut's mission and vision are displayed here. These are 2 statements that we really ground ourselves in. These statements also lead into our state identified measurable result, and that is that as a result of early intervention, children and their families or parents are able to better advocate for their child, describe their child's needs and abilities, and help their child develop and learn. And this is really signifies the importance of working with families. So Birth to 3 is not only a child-focused program, it really focuses on supporting the parents and helping their child develop and thrive. And we view this as setting that family up to have success later on. So we'll get to that. Understanding from the families what they need help with really positions us in helping that family be able to help their child throughout their lives. So that's transition into preschool special education, perhaps, but even beyond that. So that's going to look like aging out of IDEA Part B. Oftentimes I hear from families and about the importance of birth to 3 years after their child has aged out of birth to 3. So I know folks who have children who are 30 and their parents are still talking about the importance and the skills they learned in birth to 3 and helping their child. So it's a lasting impact, and that's the goal of the program. Next slide, please. So to do this, we really have 3 pedagogies in early intervention, and that is natural learning environments, which I had spoken briefly about. So really supporting that child in the environments where they spend their day-to-day, and coaching as a style of interaction. That is not couching. Some folks really get tripped up on the coaching as a style of interaction and think we're not providing supports to the families, but it really is. We have interventionists who are physical therapists, occupational therapists, speech and language pathologists, teachers, social workers, etc. And they are helping the families through putting the parent in the driver's seat. So helping the parent understand their child, helping the parent through these interventions. Coaching as a style of interaction really is based and rooted in some research. So there was a really significant research study that looked at the amount of steps children need to take in order to master walking. And what it resulted in is ultimately children walk 29 football fields in one day to master walking. So we're not going to see that in a 1-hour visit. So coaching families and helping their child take those steps between visits signifies the importance. So that is one pedagogy in early intervention. And then primary service provider as an approach to teaming. So every family has a team of professionals behind them, but there is one person that is primarily providing those supports. So if there is a motor concern that comes in as that referral and we identify as the child having a motor delay, the physical therapist might be that primary service provider, but it doesn't mean that family doesn't have access to a speech and language pathologist, an OT, or another professional. It's just that person is going to have that main point of contact with the family and coordinate those services, and that's under service coordination. And with all 3, if we look in the center, that increases the parent's confidence and competence of the parent, which optimizes family outcomes and child outcomes, which can lead to transition, which I think is the next slide. So when we think about transition and we think about continuity of care and the relationships between early intervention staff and local education agencies or LEAs, it's important to note that Part C and Part B is like comparing apples to oranges. So there are 2 different programs, and how we think about transition and how we think about setting families up for transitions really makes a difference. And those relationships at the ground really matter. The relationships between Renee and I matter in the agencies, but also between the programs at the ground level. In IFSP, which is the Individualized Family Service Plan, is what dictates the services in Part C. And in IEP is what is going to drive the services once that child reaches preschool special education and beyond. And each has a different purpose, and they are like I said, Part C and Part B are different. So we're comparing apples to oranges a bit here, but we'll go through in terms of who is responsible for what. So if you go to the next slide. Thank you. I'm going to pass it here to my colleague Renee to talk about what happens when a child's about to turn 3.
Thank you, Nicole. So birth to 3, they work with the family and really start talking about that transition process. And by the time the child is 2.5, birth to 3 does send all the information over to the LEA. In the past, it was through CDEC, and now it is through CT-SEDS. So the LEA will get notification of a referral that has come through from birth to 3. And then the birth to 3, the service coordinator will plan a transition meeting. And they need to get consent from the parent, though, to involve the LEA. So there are times, though, that a parent might choose to not want to have their school district involved.
in this process, and that is the parent choice. But most often the parents do sign consent for the school district to be involved in the transition planning. And during this time, and we'll go into it a little bit more, there is a transition meeting that Birth to Three hosts, and the LEA does have somebody come to represent the district to really answer some questions for the parents and to learn more about the child, because before the child turns 3, the district needs to have completed the referral process to special education. So that means they would need to have held the referral PPT meeting. And if the parent has given consent for the district to do an evaluation, completed that evaluation, and then determined if the child is eligible for Part B services, and that's the special education services provided by the district before the child turns 3. If the child does qualify, their IEP, their individual education plan, does need to be implemented on or before their 3rd birthday. So referrals to special education. Anyone can make a referral to special education. So sometimes the referrals don't only come from Birth to Three, but might also come from some community childcare centers if the child also is about to turn 3 or has already turned 3. Or sometimes also librarians in the community, family resource centers, pediatricians. But the parents do need to give permission for the evaluation. They do need to sign consent for that. You go to the next slide, please.
And just to put a plug in, I would regret to not mention this. Anyone can make a referral to Birth to Three as well, but only the parent can provide permission for the evaluation. And with that, as Renee said, only the parent can provide permission to with the referral for Part B. But when we talk about transition, there are differences, and oftentimes there's conflicting information out in the field. So we like to be clear of who's responsible for what under IDEA. So that looks like, in terms of the Birth to Three standpoint, we provide a general release of information, or Form 3-3, which notifies the school district that there is a child in their town, and that is with parent permission. They sign off on that general release, and that information is nightly fed to the State Department of Education, and that is that notification, which is now CT SEDS. And then there's also an approval to include the LEA in transition planning. So that's Form 3-8. And that is a transition conference. And that is a conference that Birth to Three owns. And that is the transition out of services. Now, that can include the LEA. It's best practice that we do include the LEA in those transition conferences. And sometimes there are times where that conference ends and a PPT1 would begin. And that is a clear delineation, but for Birth to Three, we do own that transition conference.
I'm sorry, Elena, were you going to say something?
Go ahead. Yep.
Okay. So now with CT SEDS, the referral is generated in CT SEDS, and then that notice goes to the parent that a referral has been completed. So all of that is done through CT SEDS once that information is generated to us from Birth to Three.
Great. Thank you, Nicole and Renee. I think that was an excellent example as to the many different components, right, and roles that each of the partners play, the different ways in which the systems need to interact, and the ways in which we are all trying to make for a seamless transition so that the child can continue learning and growing and developing, and really the critical role that families play. Next slide, please. So at the OEC, we really wanted to give families tools and practices that they can use to assist with their child's learning, both at home and to help guide them in their child's development as well. And so we're really excited that we are supporting the work of Sparkler, giving families free access to this tool to help track their child's learning and development, and also to be able to have access to coaching and playful activities that they can do with their child throughout the day as well. So I did want to show this really short video for people who might not be familiar with Sparkler.
Okay, just give me 1 second and I'm going to pull it up.
Thank you, Carrie, for managing the tech.
Sure. I think it's going to work. Hold on 1 second. Okay. Can you hear that?
No.
Okay, let me go back to Teams. I practiced this too, you know. All right.
You have to share with audio. Yep.
Yeah, I have to put the audio on. That. Okay, and now we're here. What's up? And here.
Parent, I want what's best for my daughter.
Okay.
Sparkler helps me get her ready for learning and life. It all starts with knowing how she's developing. When I take the Ages and Stages questionnaire, the leading measure of child development, I get insights about my daughter's growth. With my permission, her pediatrician and teachers can see her progress too. When we're on the same page, I have more support to help my daughter thrive. Sparkler creates a personalized playbook for my daughter based on her progress and passions. It's full of playful and powerful ideas.
Did that freeze for other people? Well, I guess we can take it down. Gotta love technology. And we can just go back to the
I
slides.
think we have a flavor for what it is, so.
Right. Yeah, exactly. So we're excited that over 22,000 families across Connecticut have signed into Sparkler and are tracking their child's progress, learning and development progress through the use of this free app across our state. And so, you know, the population that's using the Sparkler app is actually more diverse than the state as a whole in terms of race and ethnicity. So over the past year, about 38% of new Sparkler children were Latino or Hispanic. 13% were Black African American, and 41% were white Caucasian. And of the families who completed the developmental screenings using Sparkler, 56% of their children were on track in all learning domains, such as communication, gross motor, fine motor, problem solving, and 20% scored as refer, indicating that they might benefit from an additional evaluation, some additional supports or intervention. And so there you see the interaction with Sparkler potentially with early intervention and special education as well. But these are tools in which the OEC is helping to provide to families to ensure the continuity of learning for their children. So Carrie, I know we had a couple more slides. Want to share? I'm going to hand it over to Kim Pileska to talk just a few minutes about the transition to kindergarten.
Great. Thank you so much, Deputy Commissioner Trueworthy. Hello, everyone. My name is Kimberly Pileska, and I'm the Co-Division Director of Early Care and Quality Improvement. My colleague Deb Fliss couldn't be with us today, so I am here in her stead and very honored to be here. So thank you. Next slide, please. So I'm going to talk just a little bit about the school readiness programs and the transition. Starting kindergarten, as we all know, is an important milestone for young children and their families. It's full of, excitement, but it can also be a very stressful time. Parents are their children's first teachers, and it's an important part of children's success in school. Transition to kindergarten efforts must include both a focus on the children and their families. The focus on transitions is intentional and important. Extensive research indicates that positive transition experiences are associated with increased family engagement during kindergarten, enhanced social skills in children, and higher academic performances in math, language, and literacy in kindergarten and beyond. The OEC school readiness programs and councils in Connecticut help prepare children for school. School readiness offers quality early childhood programs that are accessible and affordable. A variety of activities are designed to meet the needs of individual children, support parents, and meet the needs of working families. Resources on transition to kindergarten are an important aspect of the school readiness preschool programs. There are 5 core values that guide effective transition practices, and these were taken from a joint document created by the OEC and the State Department of Ed. Collaboration, responsiveness, and trusting relationship with families, ongoing communication with stakeholders, including families, program staff, and others, respect for diverse and cultural backgrounds and experiences, strengths and needs of children and families, and positive relationships between adults and children as foundations for children's learning and development. Next slide, please. The OEC supports the transition to kindergarten, both for families and providers. Many of these resources were created in conjunction with the State Department of Education and cover important topic areas such as what to expect when going to kindergarten, child development, and strategies to support learning at home. As you can see from the slide, we have a Hello Kindergarten information booklet. We also have information on child development, and we also have the Connecticut Early Learning and Development Standards Strategies for Learning at Home. Next slide, please. So here are just a couple of the professional learnings that we have available for the Office of Early Childhood. Resources help providers support children's learning and development. We also have the Connecticut Early Learning and Development Standards, which I talked about previously. We have information for family child care providers, and all of these sessions will be offered before the start of the school year in fall 2024 to address the needs of programs will be serving older preschool students due to the change in kindergarten entry that takes place September 1st of 2024. Next slide. Transitions not only include the human and relational aspect, but also must include the educational content and materials. This should be seamless, meeting the learning and development needs of each child to support their continuous learning. As such, we'll be working to review and distribute documents that crosswalk the Connecticut Early Learning and Development Standards and the CT course standards across domains and content areas. We're also collaborating to review and update the standards, curriculum, and assessment professional development opportunities to ensure that they address slightly older children who will remain in early care and education programs. We hope to ensure that programs have resources related to appropriate learning techniques and trajectories to children not yet age eligible for kindergarten, and that they have strategies and resources to support the planning and adapting curriculum to meet the needs of the range of children in their care. Next slide.
And that's it. Thank you so much, Kim. So as you can see, these are just a few ways in which the Office of Early Childhood is looking at and supporting families and working with the various providers and partners in the communities and at the state level in order to ensure that young children and their families have a continuity of learning, are supported, have access to the resources that they need to ensure that their child is healthy and developing. So thank you very much.
Elena and OEC, thank you so much for that presentation. And so now we're going to turn to our next presentation on the Fatherhood Initiative and EBT by DSS.
Thank you, Lieutenant Governor. I'm going to introduce my colleagues, Dan Giacomi, our Director of Program Oversight and Grant Administration, and our former SNAP Director, to walk us through the Pandemic Electronic Benefits Transfer, or EBT as we call it, followed by Tony Judkins and Diana DiTuno, our dynamic duo who oversees the Connecticut Fatherhood Initiative. Thank you very much.
Good afternoon, everyone. As Deputy Commissioner Hadler said, my name is Dan Giacomi, and I'm going to be doing a recap of the Pandemic Electronic Benefits Transfer, or Pandemic EBT program, which was a temporary, what says child nutrition program, but joint venture between the Department of Social Services and the Connecticut State Department of Education to provide EBT benefits to children eligible for child nutrition programs, which, if it sounds a little bit complicated, definitely was just the beginning, as you'll see. Do want to point out that we do have our colleagues here from the Department of Education who are great partners in this program and provided a myriad of benefits to children throughout the state. If we can go to the next slide, we'll talk a little bit about the background of the PEBT program, or what we called PEBT 1.0. As you'll see, it was part of the 2019-2020 school year as a response, or as a provision of the Families First Coronavirus Response Act of 2020. It did say it was a temporary emergency nutrition benefit. I don't think any of us that were contemplating it in year one contemplated that we would still be issuing those benefits in 2023, but nonetheless, here we are. As part of the benefits, the eligibility was for all children who would have received free or reduced price meals through the National School Lunch Program, if not for school closure, where schools were closed for equal to or greater than 5 consecutive days. The benefits provided were $364.80 per eligible student. And as you'll see at the bottom there, it covered the governor's school closure date of March 17th, 2020 until the average school year end date in June of 2020. We looked at the prices themselves of the National School Lunch Program reimbursement rates, and we multiplied that by the average end date of schools, and that's how we came out to that benefit of $364.80. We were able to provide those benefits rather quickly to over 300,000 private school students, as well as individuals in, public school students, as well as individuals in some of our private schools that participated in the National School Lunch Program as well. Year one ended, we thought we were in a good place, that if year two continued, we'd be able to provide benefits much in the same manner to much of the same group of individuals, but we're throwing a little bit of a curveball. So if we could go to slide 2, please. You'll see that for the next school year, 2020 and 2021, we needed to incorporate changes that were made through amendments in the Continuing Appropriations Act of 2021 and other Extensions Act, as well as amendments made in the Consolidated Appropriations Act of 2021. We also needed to figure out a way to provide those benefits, or benefits in general, to children throughout the school year who may have been home for exposure or a positive result of COVID-19. So we had to pivot to come up with a new plan itself. As you'll see, the eligibility became for school children who received free or reduced price meals through the National School Lunch Program, if not for school closure or school reduced hours or attendance. Those of you that had small children, such as myself, are well aware that many schools, if not all of the schools, experienced one or both of those events throughout the 2020-2021 school year. Another piece of this is that it also included what they considered to be children in child care facilities. However, under the latest amendment to FCRA, the federal government decided that all children under the age of 6 receiving SNAP benefits in the state of Connecticut were considered to be enrolled in a covered child care facility. Part of that reason is it became very obvious that we would not be able to determine all of the different permutations of what a child care facility is when you include home daycares, staying with family members that are licensed providers, staying in a facility themselves, or those facilities that are co-located in schools. There were, as I said, many different permutations as to how we would be able to get to that point. So thankfully, the federal government did step in and say that it could be all children under the age of 6 receiving SNAP benefits. I see a piece of that is cut off here on this slide. So it's under the age of 6 receiving SNAP benefits were considered enrolled, and it allowed for us to make some other simplifying assumptions, as we'll get into in the next slide, please. So as part of the next slide, what we did to determine if the child in school was eligible, we asked 3 questions. First, we asked, did the child's school participate in the National School Lunch Program? Second, we asked, was the child eligible to receive free or reduced price meals in the program, either through something called direct certification, which is for children receiving SNAP benefits in Connecticut, children receiving TANF or TFA benefits in Connecticut, or children receiving Husky A or Medicaid insurance up to income at an income level at 185% of the FPL. And was the child's school closed, or did the child's school have reduced hours or attendance for equal to or greater than 5 consecutive days? Once we were yes to all 3 of those questions, we then had to determine what the benefit amount would be for that child. And we did that, as I said, through our partnership with the Department of Education. The Department of Education came to us and let us know that they were collecting attendance data from all of the schools with children, and part of that attendance data showed a monthly student learning mode. It showed that, as you'll see on the right there, which is an example, the percent of children that were receiving their education model fully in person throughout the month, mostly in person throughout the month, hybrid, mostly remote, or fully remote. From there, we were able to calculate the amount of time that a child was in class, as well as the amount of time that a child was learning remotely or out of school because of an illness. And we're able to bucket them into the categories of being able to provide benefits to them. Separate from that, as you may have seen, if we go to the next slide, please, from the previous slide, that there were these children, quote unquote, in childcare facilities as well that we needed to provide benefits to. So for them, we had to ask a different set of questions. As you'll see on the screen, we had to ask, was the child a member of a household that received SNAP benefits at any time on or after October 1st? October 1st being the beginning of the new federal fiscal year, which is how that date became codified by the federal government. Second, was the child enrolled in a covered child care facility, which, as we said, was all children under the age of 6 receiving SNAP benefits. Was the child's covered child care facility closed, or did it have reduced attendance or hours for at least 5 consecutive days, resulting in the child's inability to attend? Or were one or more of the schools around the child care facility or around the child's residence closed or have reduced attendance? In working through guidance provided by the OEC as well as by the Department of Education, we were able to establish that all schools throughout the state of Connecticut were closed or had reduced attendance or hours for at least 5 consecutive days throughout the year, which meant that, again, we did not need to determine eligibility for these minor children under the age of 6 on an individual basis, but instead could look at them as all children under the age of 6 qualified for these benefits and be able to provide what was an average of 50,000 children monthly with additional SNAP benefits as a result of this program. Next slide, please. So looking at that, you'll see the monthly benefits, as we talked about, based on learning modality that we had. So the full daily benefit level for each eligible child was equal, as I said previously, to the free reimbursement rate this year, including the school breakfast program, as well as the National School Lunch Program and snack program for the 2021-2022 school year. Excuse me, 2020-2021, not 21-22. 2020-2021, which was $6.82 per day. We then looked at the average amount of time that children were out of school, multiplied it by that amount, and came up to the benefits that you see on the screen there. childcare benefits were only given to those months that a child was was receiving SNAP benefits from October through June, which covered the same amount of time as the school year. So it varied per child depending on which months they were receiving SNAP benefits, but the full benefit amount for a child that was receiving SNAP from October through June was $716.10 per child that provided. And then we also had an additional program, which was a summer benefit program, which covered the period of time after the school year for the subsequent summer months, which was equal for the school children and childcare children, which equaled $375 per child. So you could see in that situation, if an individual had the full childcare benefits, so they were receiving SNAP benefits from October through June, as well as the subsequent summer period, that household could receive benefits just topping $1,100 for that year, in addition to the normal SNAP benefits that they were already receiving by being part of the SNAP program here in Connecticut. Subsequently, or similarly, the monthly benefits, you could see, you multiply those by just about 10 months for the school year itself. You're looking at, $1,200 there for the fully remote children, plus another $375 that they would be receiving as well. Next slide, please. We then transition to the 2021-2022 school year and summer period, which again came with more changes as a result of the American Rescue Plan Act, which again changed the eligibility criteria that we had to use to determine eligibility for children in schools. Now we still ask, did the child's school participate in the National School Lunch Program? We still asked, was the child eligible to receive free or reduced price meals? But now, rather than asking if the child's school was closed or received reduced hours, we had to determine, was the specific child that we were providing benefits to absent or learning remotely for at least 5 consecutive days. And the remote learning or absence had to be as a result of COVID-19 themselves. So it couldn't be because the school was closed, that child themselves had to be absent due to COVID-19. However, there were no changes to childcare or summer eligibility, and there were no changes to how we determined, there were changes to how we determined the monthly benefit amounts for childcare as well. But you'll see at the bottom there, state law passed in June 2021, under which remote learning was generally not permitted, significantly reduced the number of children eligible for school year benefits. It helped our program to determine who was eligible because it specified who could learn remotely per year, but it reduced the number of children that would have been eligible for school year benefits because it no longer allowed schools to close or reduce hours due to things such as a small outbreak or something of that nature. Next slide, please. Similarly, we had monthly benefits for the different learning modalities per child. We did have a full child care benefit, and we did have a summer benefit, both which were increased from the year before. Using the same data as we used, or the same amounts as we used from the previous year with school lunch, school breakfast, and snack, it was $7.10 per day. We then, again, were able to group individuals into the amount of time on average per month that they were out of school. 18 days on average for a child who was fully remote, 10 for a child who was mostly remote, and 3 for a child who was learning in a hybrid environment. So we used those days multiplied by $7.10, and that's how we came up to the benefits amounts that you see on the screen. For the child care benefits, however, we had to take a percentage decrease of the meals that were served through another child nutrition program operated through the Department of Education called the Child and Adult Care Food Program, or CACFP. we had to look at the amount of meals served in 2019 through that program, look at the amount of meals then served in the current year in the program, take the percent decrease in meals served, and utilize that to say, okay, we would take the same decrease percentage from the fully remote benefit you see on the screen there, and multiply that to get the full childcare benefit per month. So if the percentage decrease for the month was 20%, we would take that, reduce the fully remote benefit for the school children of $127.80 by 20%, and that would be the amount that a child in child care facility would receive for that month. Next slide, please. And that brought us to the most recent school year and summer period, which again, the more things change, the more they stay the same, brought more changes to the program itself. The Consolidated Appropriations Act of 2023 made even more changes. What it did is it delinked state participation in the summer EBT program from participation in an approved 2022-2023 school year plan. Previously, what it meant was we would not be able to issue the summer benefits that I mentioned if we did not also issue benefits throughout the school year to the children. For those of us in Connecticut, what that meant is that effectively we wouldn't have been able to operate a PEBT plan because the overwhelming majority of our children were in school full-time learning in person. We were no longer tracking the COVID-19 absences, or did not have the data that would make it available or allowable for us to operate the program. But by delinking the participation, we were able to still operate a program for summer of 2023, as well as a childcare program, which is something we spoke of as well. One of the other things it did, however, is it reduced the summer PEBT benefit amount. It was no longer the fully remote amount times 3 months. Instead, they capped the amount that we could provide to an eligible child to $120. As you can see, it was about a third of what we were providing previously during the summer period. As a result of the data and the other challenges that we had, we did not distribute benefits to school children during the 2022-23 school year, but we did distribute summer EBT benefits to school children. One of the other changes that came about was the ending of the federal public health emergency. Unlike the school year benefits, the child care benefits could only be distributed when there was an when there was an active federal public health emergency in place as a result of the COVID-19 pandemic. With the ending of the COVID-19 pandemic in the spring, we were only eligible or allowable to issue childcare benefits from October through May, October 2022 through May of 2023. So you'll see on the next slide, please, the amount of benefits that we're able to give out. So for a child in the childcare facility, which again effectively means any child under the age of 6 receiving SNAP benefits, receiving benefits from October 2022 through May 11th, 2023, which was the end of the federal public health emergency, they would receive $172.72 per child. And all of the children, as I previously mentioned, receiving summer benefits, so all of those eligible for NSLP in school received $120. A lot of information about the eligibility and benefit amounts, but let's look just a little bit on the next slide, tangibly about those that we ended up serving. You'll see on the left side the average number of children served. So the average number of children served in the first few years of the pandemic EBT program was 301,050 children. That's, again, average per year. We served just over 300,000 children. In year 3, as I mentioned, with the reduction of, with the change in the ability to learn remotely, the number we served for that year was 98,860. While obviously not the same as the over 300,000 children, still a significant amount of children receiving benefits during the school year itself. During the summer months, due to children moving out of state, changing schools, graduating, or otherwise, the number we served on average was a little bit less, but we still served around 289,960 children during the school months that were receiving these additional benefits. As I mentioned earlier, the child care children, as you'll see in the dark purple there on the left-hand side, was an average of 55,000 children under the age of 6 on average receiving additional SNAP benefits as a result of the PEBT program. And the amount served, again, you'll see it broken down there on the right side by year, but the total amount of PEBT benefits that were distributed as a result of this program was over $683.7 million that went directly back into the Connecticut economy. We use at the DSS and nationally numbers that say for every dollar spent during an economically sluggish period, about $1.50 is reinvested into the economy for every dollar spent at SNAP. So those of you that are much better at math than I can do the calculation. If we were to say $683.7 million were provided to the students, how much of that went directly back into the Connecticut food economy and directly back into the hands of children that needed a little bit of an extra boost or a little bit of extra food, as well as their families. So what did that mean specifically, other than the close to $1 billion that were put back into the economy itself? If we go to the next slide, what we saw is that the share of households where children were food insecure reached a 2-decade low in 2019, but increased significantly early in the pandemic. However, this measure returned to the pre-pandemic low in 2021. Now, we know that in 2019, 6.5% of households with children had or indicated that they had food insecurity. By 2020, that had reached over 7.5%, 7.6% of households with children. But then by 2021, it was actually below where it was in 2019. It was 6.2%. So it returned back to the pre-pandemic low. It's notable that the rate of food insecurity among households with children declined in 2021, despite unemployment rates remaining above pre-pandemic levels and the rising cost of food and other basic necessities. It may reflect the effectiveness of the policy response to the pandemic or policy responses as a result of the pandemic, including the child tax credit and the pandemic EBT program. But we recognize that this was not the only child nutrition or food program that was implemented during the state. And I know my colleague and partner, John Frasinelli, is here on the call with us, and I hoped to ask John if he wanted to speak a little bit about one of the other programs that was a tremendous success during the pandemic itself.
Yeah, thanks, Dan. And I hope everyone, as Dan went through the presentation, can appreciate the complicated web, both that the federal government had put in front of us at the beginning of the pandemic, and then sort of changing direction midstream in each year of the pandemic EBT. But I do want to recognize the partnership between the Department of Education and DSS. We've heard around the country that was a national best practice, and we've heard from a number of other states who struggled to get these programs off the ground. But working together in Connecticut, you can see just the impact that it had with the over 300,000 kids receiving meals and navigating the different benefit amounts based on remote learning and things. I do want to mention that with the change in the state law, but this program, the pandemic EBT program, was meant to supplement the National School Lunch and School Breakfast program, right? That was the complicated part with understanding when students were remote versus when they were not, when students were out during COVID, because as you're aware, participation in the pandemic EBT program was predicated on the fact that the schools participated in the National School Lunch Program. So when the kids were in school, they were obviously getting, breakfast in most cases and lunch when they were in school. So this was meant as a supplement. But it just goes to show you how great the need was during the pandemic with households that were food insecure, with folks who were losing their jobs or losing incomes because of reduction in income.
Thanks, and that is all I have. I appreciate you giving me the time to provide some information about that, and thankful, as John mentioned, to our partners at the Department of Education as well as OEC for helping us to be a model to other states through this program and to be able to provide these much needed benefits to children throughout our state.
Thank you. That was great. We appreciate the presentation, and I will ask if anyone has any questions for anyone. All right. Okay, it looks like Doug Casey has a question. Go ahead, Doug.
Great presentation. And I just look at sort of lessons learned through the issue of safe food insecurity and what could we take away, and we'd love to hear your thoughts on that. That's one question. And then the other one is the last chart around sort of the decline of food insecurity household wise. Yeah. Is that nationally or is that Connecticut specific?
Thanks, Doug. I think they're actually intertwined, and I'll say this, the chart itself is nationally. We did see similar results here in Connecticut as well, but one of the things not mentioned in this slide is now with the sunsetting of these programs, we're actually seeing, again, an increase in food insecurity itself, both nationally and here in Connecticut. So I'll say that I believe that these programs do work. You know, that's lessons learned here is that these are helpful in helping our children and our families. The benefits are spent here in the state of Connecticut themselves. And there's plenty of research and information that is out there around the holistic effect of having healthy and nutritious food for children and the effects of the family itself in reducing stress, increasing the ability to learn, increasing the healthiness of individuals, et cetera. So if I were to say what our lesson learned throughout this is that it was an effective program. We hope to be able to build upon this program both here in the state and nationally to look for other ways to provide additional benefits, whether it's SNAP or otherwise, to our most vulnerable, to continue the work that was done through this program.
Thank you. And I'll just say that what was impressive to the governor and I during the pandemic is when schools were closed, our local education leaders realized immediately the impact that this would have, schools closing would have on families. And I can't tell you how many food distributions I went to that were run by school districts, and community members, restaurants got involved as well, providing food to families over the weekends. And we've also saw how increasing the EITC and giving families credit for kids both at the state and federal level helped reduce child hunger and food insecurity. And so, you know, the governor and I were really proud of the work that we've done. And I know our federal legislators like Rosa DeLauro are working on continuing to expand benefits for kids. And so this will be, you know, a continuing challenge going forward. And here we are in a state where 1 in 9 adults are food insecure and 1 in 8 kids are food insecure. So, you know, during the pandemic, we did well, and this is something that this is an important issue that we have to continue to try to fight, because kids can't learn if they're hungry.
Thank you, Lieutenant Governor. It's John Frassinelli again. And I also want to acknowledge the work of the school districts themselves, who really shifted gears when schools closed in March 17th. Those programs went from serving all of their meals in their cafeteria to then dispensing meals around the state. So, they were able to provide meals to children within a couple of days, so nobody really missed a school meal that was able to do that. And also want to acknowledge your leadership, Lieutenant Governor, and the governor's leadership in continuing to support school meals for children. Your administration has appropriated $16 million to support free breakfast for all in Connecticut, and the most at-risk students who are eligible for reduced price meals, to support free meals for all of those students this school year as well. So we appreciate that.
Absolutely. All right. So if there are no other questions on EBT, we'll go on to the next topic.
Great, thank you, Lieutenant Governor, and appreciate those kind words about the team's administration of the partnership with the Department of Education. It was really a tremendous lift, and I think beneficial to all of the families here in Connecticut and all of the school children. I'd like to now turn it over to Tony Judkins and Diana DeTuno, who are the leaders of our Connecticut Fatherhood Initiative, to walk through an overview of the program and the work that they have been doing.
All right, great. Thank you, Peter. Good afternoon. I'd like to thank the council for inviting us to present today, as we appreciate the opportunity to provide you with a high-level overview of Connecticut's approach to a coordinated statewide effort to support fathers and their families. We hope to answer any burning questions that you may have and dispel any myths and common misnomers about the initiative. But today's program or presentation will really focus on the statewide collaborative versus drilling down into our community programming. First and foremost, I'd like to say that the efforts of the Connecticut Fatherhood Initiative, and we finally call it CFI, are not done at the expense of mothers. Children are at the heart of this collaborative effort of state and local partners. We focus on supports for fathers, not just to assist them in their fathering role, but also to support mothers and children. It's not an either-or situation here. We don't seek to take services from one to give to another. It's not about gender wars here. It's us, seeking to support both parents, whether they live with their children or not, and ways to help them be positive forces in all aspects of their children's lives. The bottom line here is the best way to help children succeed and have better outcomes is really to support both their parents. Next slide, please. So the Connecticut Fatherhood Initiative serves as the umbrella agency for all state agency efforts to support fatherhood. And what this simply means is there's only one Connecticut Fatherhood Initiative, right? While our CFI partners, partner agencies are conducting fatherhood efforts within their respective agencies and with their respective partners, these all fall under the umbrella of the CFI. And I say this because, our partners are doing great work and we love that they're doing the great work. But what happens is it becomes a little confusing to folks in the community or just folks in general, because what happens is, our partners may call the work that they're doing to support father, they may call it something different. They may call it, like our partners at DCF, they call it Dads Matter Too. OEC does their work through their home visiting program. So they call it different things, but it's all under the same umbrella. It's this umbrella of the CFI. So we just want a little clarification on that. The CFI is currently developing a high-level introduction of slides for any party to use when presenting their agency's fatherhood work to various audiences to align with the CFI branding efforts and to reduce the confusion. Next slide, please. So in Connecticut, the legislation has been a foundation for our work since 1999. Connecticut was the first state in the country to pass legislation on fatherhood. Many states before us had governor's commissions or councils, but no one legislatively required the work. The legislation here was very comprehensive and instructive. It named DSS as a lead agency for the initiative. It also named our state and community partners to serve on our council. It outlined a research and demonstration program with 3 pilot sites to focus on father engagement from 3 different perspectives. One being children under the age of 5, a workforce development model, and serving the incarcerated population. The late John S. Martinez, a former Connecticut State Rep in New Haven, really played an integral role in the passage of the initial legislation. He and key leaders at the state and local levels came together for a common goal as they continued to see children who had been impacted by father absence, and they recognized that this was a nonpartisan issue and created a comprehensive social policy that reflects a desire and a vision to really affect positive change for fathers and families and children in Connecticut. Next slide, please. So in 2022, we had some new fatherhood legislation that was passed. We repealed the 1999 legislation and replaced it with Public Act 22-138. And that legislation, what it really did was more appropriately reflect the current infrastructure of the CFI, which had been in existence at that time for 23 years. So some things had changed. So we just wanted to really reflect what the current infrastructure was. It also outlined what the members have agreed to, like providing active participation on our council, supporting fatherhood events and activities, seeking opportunities to collaborate more with each other, seeking funding opportunities that would support fatherhood, and continued active participation in the implementation of our strategic plan. Overall, the new legislation really just reaffirms the work and commitment the CFI partners have put forth over the last 24 years. Collectively, the partners have worked, the partners' work has begun to really improve how fathers are recognized, included, and supported in their roles within the multiple agencies that serve them. This work in service of strong children is really critical. Next slide, please. So this slide really represents who we are as the CFI and how we approach the work, right? The CFI is a multi-agency, statewide multi-agency collaboration of state and local partners led by the Department of Social Services, working since 1999 towards a common goal, which is a really simple goal. It's to support children, mothers, and fathers by focusing on the important influence of men who are or will be in fathering roles. And we do this through our systems change efforts, by supporting direct services and programming in the community. We also do this with a commitment to racial and gender equity, as women in our community do participate in our fatherhood programming. And we also, and more importantly, it's a commitment to safe engagement. So we want our fathers and families to be safe when they're together. We have a really unique model here in Connecticut, and we're seen as a national leader in this work. And since our journey in fatherhood began in 1999, and we're really proud of the hard work that we put into it and continue to strengthen it ever since. So I'm going to stop there. I'm going to pass the baton to my colleague Diana, and we'll leave some time for you guys to ask us questions at the end of the presentation. So thank you.
Thanks, Tony. Good afternoon, everybody. Thanks again for having us. And I want to thank Kari for putting into the chat a couple of documents that I had forwarded to her along with our presentation. One is the sort of one pager is what we call it, is our CFI overview. Again, high levels, talks about our focus, our framework, and information that we're sharing here today, as well as the legislation that Tony just mentioned. So I want to say thank you for putting those in the chat again, because it wasn't for some reason letting me upload anything. So we can go ahead to the next slide. I'm going to just mention the objectives of our legislation because they have not changed since the initial passage of the legislation. So when we did support the passage in 2022 to reflect our current infrastructure, the council really looked at the objectives and said they really haven't changed. I won't read through them, but what I'd like to highlight is a couple of the phrases that are used throughout. So one of the phrases is emotional and financial, or financial and emotional. Both of those are put into these objectives because it really isn't all about financial support for children when we're talking about thriving children and families, right? If money solved all of our problems, then everybody would be healthy, wealthy, and wise, right? And so we know that the emotional connectedness between parents and children is critical. And so this was a paradigm shift back in 1999, because historically we really did look for financial support and other things from both parents, and particularly parents who weren't in the household, who were primarily fathers. But what we know is that as parents and children are emotionally connected to each other, some of those other things actually can fall into place as we're looking to support the men in our state in their fathering role. The other phrase is regardless of marital status. Another thing that the leaders noticed when we initially passed the legislation, which is still true today, is that not everybody comes through the parenting through a legal route of being married and having kids that way, right? So we have a lot of fathers and mothers who have never been married to each other in our state, and we don't pass any judgment on that. Families come together in all sorts of ways. We're very inclusive of that and appreciative of that. And what the most important thing for this legislation and the work that we're doing is the parent-child relationship. So whether parents stay together as couples is up to them. But what we want is to make sure that no matter what the marital status is of these parents, that we're looking at that parent-child relationship and looking at our ways, our resources, our services, and our systems, and how are we best supporting both of those parents in that role, whether or not they live in the same household as their children. Next slide, please. So Tony talked about collaboration. He talked about how DSS was named as the lead agency as this was sort of an anti-poverty approach to the work. And we are the lead agency for the TANF program and the child support program. But we do not do this work in a bubble and never have. One of my biggest pet peeves is that people call it a DSS program. It is not a DSS program. We are a statewide multi-agency collaborative that has a lot of active participation from many, many state agencies and local agencies and advocates and researchers, all of these wonderful folks around our table coming together around our common mission and goals. Several of the agencies you see are highlighted on this slide in yellow. That's because you're also on this interagency council doing very important work around a common goal. So we have our Department of Children and Families, our Department of Housing, Department of Public Health, Office of Early Childhood, our State Department of Education. John Frasinelli also serves on our Fatherhood Council as his commissioner's designee. So John is in every room, everywhere, and we're very appreciative of him in particular. We have our Judicial Court Support Services Division, as well as our Family Support Magistrate Division and our Support Enforcement Services Division, our child support partners on the judicial side, all playing active roles because we're serving the same fathers. CT State, formerly the Connecticut State Colleges and Universities. I think you're officially formally that. We changed it on our slide. You have been a partner for many, many years as well, because there are many, many students across our state that are student parents. And when you go and you're seeking higher education and different ways to sort of better your career path or your educational path, when you're doing it as a parent, it's very different than when you're not. And so really that's what we're coming around the table about. What are we looking at? Are we seeing individuals coming into our systems as individuals? Are we asking the questions the right way to see if we can get at that relational aspect? And if they are a father, whether or not they're living in the same household as their children, we want to make sure that we're connecting them to potential resources to support that role and looking at how we're asking those questions. So we're very appreciative of the work of our partners and their commitment to our work. And also your ongoing contributions in so many ways within your own systems and across. Next slide, please. The strategic plan for the Connecticut Fatherhood Initiative was a big undertaking. And again, it couldn't have been done without the support financially and otherwise of our many, many partners. We had over 80 individuals from over 50 agencies or entities in Connecticut informing our work and development of this plan. It was done over an 18-month period from September 2013 to 2015. It was officially launched in 2016, and we've been working on implementation ever since because there's a lot of strategies, short-term and long-term. We have a lot of work that we've been doing and a lot of work still to do, addressing program policy and system barriers to fathers' engagement with their children. We want to expand our promising practices that are already being implemented within our systems and across the collaborations. And we seek to establish new relationships and strengthen the existing relationships and the partnerships at state and local levels to support the plan's results statements. Next slide, please. So the plan itself, again, this is obviously very high level, and we can get you more information. We're more than happy to provide information. Some of the plan, it's a very fluid document with some new partners coming and the CFI Council sort of guiding the work of the implementation to sort of shift it the way that it needs to. But overarching, we have 5 active domain committees, and we have one work group, which is the CFI 211 work group, which I'll talk about after I just briefly go through the committees. Domain 1 is focused on fathers being economically stable. It is led by our Department of Labor and has many state and local partners around the table thinking about all the things that fathers might need with regard to employment, education, and all the supports that come with being economically stable. So whether it's housing, whether it's childcare, whether it's needing SNAP themselves in their household, whether or not the child's living with them, all those things to help them become economically stable so that they can better support their children as well. The domain 2 is a very large domain, expansive, and it's sort of the leader of that domain, the chair of that domain depends on the focus. When it initially started, we were focused in the acknowledgement, the paternity acknowledgement phase of the work, and there were several different entities that were involved in that process across our state. And so we got together to kind of talk about how to streamline and create strategies around making that easier for folks. Right now, the domain 2 is focused in the child welfare system. So our partner DCF is leading that domain. And that is fathers in healthy relationships with their children, co-parents, and significant others. So we're doing work in the child welfare realm right now for domain 2. Domain 3 is also led by the Department of Children and Families currently. It was formerly under the State Department of Education's purview because they were connected to those youth service bureaus and the families with service needs. And then it sort of shifted. And so now that DCF has a connection to those youth service bureaus, we're really trying to get them engaged around the state. And so we really are focused on young parents being prepared, young people being prepared to be responsible parents. We really are focused on young fathers and fathers to be. So we really need to focus on that special population because the needs are even greater and different when you are a young father. So we are focused in that area for domain 3. Domain 4 is men involved in the criminal justice system, another very extensive system that we need a lot of work to sort of do some systems change around that, supported in being responsible fathers. So again, if somebody enters the criminal justice system from arrest through reentry, are we asking the questions, do we know if there are children attached to that father, that man, where we want to make sure that we're not putting barriers to their engagement and their continued engagement. And when they re-enter community and re-enter work and all of those things, they're also re-entering family. Are they prepared for that? There's lots going on in that system. And so we are engaged in all levels of that, whether it's law enforcement, public defenders, chief state's attorneys. We're getting a lot of new partners around that table as well. That's co-led by the Court Support Services Division, as well as the Yukon Institute for Municipal and Regional Policy. Children Children of Incarcerated Parents Initiative in particular. Domain 5 is another very expansive domain, policy and public awareness. That's where our branding comes in, our messaging, really trying to have people understand we are one initiative and many, many partners coming to do a lot of great work under that umbrella of the CFI. We're also looking at data development. That's one of the biggest issues for this, because if we're not counting somebody as a father in our systems, then we can't get information. We know anecdotally we're sharing a lot of the same families, but we don't necessarily know what all the needs are unless we're identifying them as such. Domain 5 is led by, co-led by DSS. Tony co-chairs that with Steve Hernandez at the Commission on Women, Children, Seniors, Equity and Opportunity. The Commission on Everything, we like to say. And then we have our 2-on-1 work group, which is representatives from all the domain committees serve on that work group. It is led by our United Way of Connecticut 2-on-1. And really they've come on board and really looked at how they can have their resources, that wonderful website and their call center staff, their database of all the wonderful up-to-date resources really be useful for providers serving fathers as well as fathers themselves. And when I was talking about the way we ask questions, one of the biggest changes that's allowing us to actually collect some data is that 2-on-1, when somebody calls their call center, they no longer ask how many people are in your household. They ask, are you a parent? The caller can choose to say no. They still give the information, but imagine that one little difference in the change of the way we ask that question, it opens up a realm of possibilities. That father, now we can count that it's a father calling because he said yes, but I don't live with my children. But that doesn't mean you're not a dad, and maybe there's some supports that we can get you to. It opens up a world of potential resources that are in our local communities, and so we're really thankful for that growing partnership as well. So I just said a lot around a lot of things, but it is expansive work. And we're happy to, like I said, share any more information about specific products that are coming out of these committees and all of that as we move forward. And we hope this won't be the first time that we're connecting to your group. The folks that are serving on your group, if they have information they want to bring back to you in your work, by all means, we're happy to do that. Next slide, please. This is the final slide. And Tony and my contact information is on here, as well as our website. And I just, if we could actually, I don't know, Kari, if you could click on the link, just so you could see, we do have our own ct.gov website. I'm not sure if it'll allow you to do that, but and it is not under the DSS website. It is its own website. DSS does do the administrative work around maintenance of that website and the support for that, because that's what we do as the named agency. We do the administrative piece. But we wanted to make sure that the Connecticut Fatherhood Initiative had its own website, because this is a collaborative and it is not about trying to find it within DSS. And so several of our state partners are in a memorandum of understanding with us, several state agencies on the executive judicial side, as well as CT State. And we all have agreed to have a link to the CFI website on our individual websites so that people can go and get that information. So that you can get some history, you can read about the legislation, the background, and any activities that are going on. It's maintaining a website can be its own full-time job. Right now, you're looking at the team between Tony and me at DSS trying to do this administrative work. So sometimes we're not always up to date, but we do have newsletters. The quarterly newsletter, which is a product out of Domain 5, is up there, as well as some other things. We also have the link to 2-on-1. We feel that 2-on-1 is the best place for folks to get up-to-date information on local resources. So we're always pointing people in that direction. And so that's in a nutshell, my piece of the presentation. Thank you, Kari, for showing that. So we're happy to take any questions.
All right, thank you so much for that. We're going to ask for questions if anyone has. And I am not seeing any at the moment, but we want to thank our presenters, and we are going to move on to technology and making sure that we maintain technology in our schools. And we're going to turn to our presentation on maintenance of technology in schools. And it's my understanding that we're going to have a short presentation today, but when we come back in March, we're going to have a more detailed presentation. And I think that's good because we do want to finish this meeting by 3, and we have a few other things to do prior to finishing the meeting. So we'll go ahead with our technology sustainability presentation.
Thanks, Lieutenant Governor. I was not able to make the last meeting, but as I understand it, there were some questions that came up around since we've rolled out a lot of computers during the pandemic, how are we going to sustain all those, or what are the costs behind those? So that's kind of the context for this. I've got some data to share, and depending on thoughts moving forward, we could look a little bit more deeply into this issue. So next slide, please. So just as context, when we talk about technology, it is ubiquitous. It's why we're able to be on this meeting right now. We all have devices that we're meeting in from, and that's just a simple example. But technology is operations, it's instruction, it's at home with kids, it's in the classroom. Another key concept is just looking at life cycle management. We had this one-time sunk investment of 142,000 computers through the Governor's Everybody Learns initiative during the pandemic, as well as a lot of software, a lot of staffing, augmentation, et cetera. And so we think shifting from sort of one-time, continuing to make one-time sunk costs is thinking about recurring costs. And then finally, the different components within technology. So thinking about the physical computers for staff and teachers and students. There's instructional software, meaning full courses, or it could be intervention software to help kids with certain disciplines. High dosage tutoring, for example. There's operational software that makes sure your buses run on time and heat your schools and keep your security areas clear, et cetera. You've got the physical networks, you've got mobile hotspots that go home with kids, et cetera. So we also have a lot of Internet of Things. Everything is Internet enabled these days. So when we talk about technology sustainability, we're really talking about technology as being a through line through virtually everything that's going on with schools, universities, libraries, et cetera. So next slide, please. When Stephen Hegedus, Holly Williams, and I presented back in 2012, we shared this slide with you, which is good to sort of take a snapshot of. It maybe puts a little bit of reality behind what I just shared. There is technology that students are using throughout their day. It's virtually ubiquitous. Next slide, please. So the pre and post pandemic data, what we have from surveys of school districts is in front of you. The blue columns represent technology levels that were measured in 2019. So the left-hand data set is one-to-one computer programs, and a one-to-one computer program, as the name suggests, means that every student gets a computer, whether they are taking it home every night or it's dedicated to them. There's one computer that's for them. So if you look at the middle school levels, back in 2019, we had a little more than half of the reporting school districts had a one-to-one computer program. That level shot up based on data that we collected this summer to well more than 90%. High school was higher pre-pandemic, as you would expect, because kids are, generally doing more homework at those levels and taking computers home. They're doing more with technology in older years, and again, comparing about 70% of high schools reporting in 2019 had one-to-one computer programs. Those numbers shot up, and currently they're right around 90%. So you can see the impact of the infusion of these computers and remote learning, whether those were ARPA and Dalio funded machines or whether they were investments that districts made themselves. Important, we have data on this as well, education technology. So the computers are easy to see, they're easy to put your hands on, but there's a lot going on inside of them. And so if you look at statewide data on educational software, and so this represents real usage that we're looking at, not personally identifiable, but we are looking at software that's being used across school districts in Connecticut. We had about 3,300 unique instructional technology titles were being used across districts. That number almost doubled over the last few years. So again, you can see we had a lot more computers and a whole lot more adoption of educational software. So I can zoom on to the next slide, or maybe we can take questions at the end if necessary. So the last set of data that I'll share with you is, and again, this came from a this summer fall survey of school districts, and we asked leaders kind of what's the current financial status of your one-to-one computer programs. And the options were that we are fully funding these one-to-one programs and they're not at risk. The next option was they're funded for this year, but they're at risk. And then the last category was that we had to cut them because they were too expensive or we had to put priorities elsewhere. So hopefully the stacked charts are understandable to you. The top bar is high school, middle school is in the middle, and elementary is at the lower level. So we're seeing generally a higher commitment at the middle and high school levels to continuing to fund these programs. And then the next slide that I've got, just to give you a sense of sort of how school districts are going about purchasing computers. About 83% of them are just purchasing them outright, which is how we as consumers tend to buy computers. We go out to Best Buy and buy our home PC. A generally smarter way of doing this is to lease them, because then you're looking at the same cost per year, and you are getting back to the sort of life cycle management. You can count on needing to replace these computers generally every 3 to 4 years. And so we'd like to see those numbers shift a little bit from the sort of sunk cost model to ongoing leases. So from this summer's data, we were able to compute an average cost per computer. Generally, we're talking about a Google Chromebook, far and away the most popular type of computer being used, of $327 per unit. So what does this cost if we were to, I pulled down current enrollment data from EdSite, if we were to give every kid in the state a computer at one time, it would be $168 million. If we were going to do a 4-year lease for all those computers, we're talking about $42 million a year cost to put a computer in every kid's hands in the state.
So my question is that one time the 168 million, is that assuming you do that every year?
No, that would be because these computers you don't need to replace them every year. So you're looking at a general life cycle of 3 to 4 years for computers. So that would be, if you wanted to make that one-time investment, it would be $168 million total. That second bullet where I'm talking about a 4-year lease, if you were to spread these out over the course of multiple years, it would be an annual investment of about $42 million.
Yeah. And does the 168 million take into account like a state or a multi-town purchase arrangement? Because it would seem to me that if you had every municipality in the state buying off the same contract, right, I wonder if it would be less than 168 million.
You might see some incremental changes. One of the things that I've discovered over the course of working at the state and prior to that doing regional agreements at CREC is that people like to choose their own stuff. So you can create a common build, but even trying to do a reverse auction, which we did through the commission a couple of years ago, you had a lot of folks saying, yes, help us. But then when we said, here are your two choices, they said, we want something else. So
Gotcha.
Point well taken, Lieutenant Governor, but actually implementing it, you know,
yep.
Isn't that the Yankee spirit?
Yes, indeed.
I think just one more slide. So just to point out, we have canvassed dozens of superintendents about what their top priorities are for our next 5-year state education technology plan, which begins the beginning of 2024. One of those top concerns was technology sustainability. So this is an important topic in leaders' minds. What we are going to do is a detailed assessment of costs. For example, I mentioned earlier, there's a lot of software costs, staff costs, et cetera. So we're trying to understand, in addition to the computers, we're trying to understand what the increase is in other kinds of costs that we may not be able to see. One superintendent who I spoke with remarked that some of the software costs have increased tenfold. So even though the computers look like they're a huge expense, some of that those unseen charges are significantly more. We do plan to continue encouraging schools to use federal program funding like E-rate and the Affordable Connectivity Program to make sure kids are connected at home, and really focusing on the efficacy of solutions. We have seen a lot of schools make redundant purchases, especially in the area of software. We encourage them to use the free tools that the commission has provided to them to create a library, to analyze what they're using, and to start to consolidate those purchases so that they're not paying for multiple products that do essentially the same thing. And then the last thing I would mention is this does tie into the state's digital equity plan, which we're launching next week. This is a 5-year plan to make sure that every resident, not just students, but every resident has an opportunity to connect to an affordable broadband connection, computer, and really importantly, the skills and support to use technology effectively. So education is a strong through line in that plan. And that's all I have.
All right, great. Thank you so much. Doug will ask if there are any questions. And I am not seeing any at the moment. And I'll just say, I think that one of the questions that was raised in the past, and maybe you can come back to us in March with some discussion and color on this, is who is the person or people at a school district that helps teachers, students, parents when there are computer issues, because there are always those. And, you know, how much is it that school districts have to invest in the resources for those folks who can help with technology? So I'll leave that as something that has been raised by education advocates and leaders. So we'll leave that for our March meeting, and we appreciate that. So now we'll talk about next steps. So we see our 2024 meeting schedule So mark March 19th, June 18th, September 17th, and December 17th on your 2024 calendar. And as usual, we always ask for our council members to suggest topics that you think we should be taking a look at and learning about. And for our March meeting topics, we intend to have the following topics on the agenda. DAS is going to come back to us with a more detailed presentation on maintenance of technology given to schools during the pandemic. And because we are in a short legislative session, we're going to ask our council members to share with the council any bills related to education or the council's work that we should be keeping an eye on during March, April, and May, our short session. Remember that the council is here to support all of you. So let us know if there's something happening in the legislature that you think we should be championing and advocating for. Kari and Christine will continue to work with the State Department of Education and DAS on the topic discussed, and we want to be having an open discussion on any legislation pertaining to education at our next meeting as well. If you have any suggestions for guest speakers who can give us some insights on topics related to our council work, please feel free to reach out to us. And I'll just ask right now if anyone has any questions or comments before we adjourn. All right, well, seeing none, I want to just say thank you on behalf of Governor Lamont and me. We so appreciate all of your hard work and dedication. And I wanted to wish everyone a very happy and healthy and safe holiday season. And we will see you all in 2024. And we are going to hereby end our council meeting on ending the achievement gap. Thank you all so much.